All right, so today we're going to be demonstrating how to get an item onto the sterile field. We're going to use this Mayo stand. So the biggest thing you want to worry about is the sterile field. You want to avoid the few inches around the field and then above are considered sterile. So you're needing to toss the item onto that sterile field, which is our Mayo stand. So the biggest things you want to do opening the item is you want to make sure that it's in date and it looks good. There's no holes or anything abnormal, and that it's sterile. And there's indicators sometimes in them, or it says there's a date on there where it's good. So you want to undo the corners first and then open it kind of like a chip bag and toss it onto the field. So today we're going to be learning how to open glove. Usually when you need to open glove, you just need your hand sterile to grab something for the surgeon in the sterile field. So you don't need to pull the whole gown on or anything like that. And then, so you want to grab your gloves, make sure that's the right size. I'm a 7. When you open it, the outer pouch, and then the inner pouch is going to become your sterile field, so anything inside is going to be sterile. So you want to be careful when opening. You want to open it and make sure to bend the bottom so it stays sterile where the gloves are and doesn't try to snap back closed, because then that's considered unsterile. Next, you want to wash your hands. You want to use the scrub, like if you were actually gowning up, to make sure you get really clean. After that, you're going to come in. I usually start with my dominant hand, which is the right, and they're labeled already. So you want to touch the parts that are going to be touching your skin, because those are considered not sterile. So just the outer part of the glove, and you're going to slide on in. Careful not to let it just flail everywhere and contaminate, and then just pull that bottom part. And then your other one, because now this is considered sterile, you want to touch the stuff that's not going to be touching your skin, so the inside of the glove, avoiding the parts that are going to touch the skin. Again, being careful not to touch anything not considered sterile. And then just pulling, and then you are gloved.
Hello! Today we're going to be prepping a patient for surgery. This is Poquito, and we're going to be doing an ovarian hysterectomy. So we're going to start by doing a rough scrub with our betadine. And that's just basically removing all the excess dirt and everything else you don't really want before you clip. And after that, we're just going to keep doing this pretty much until we don't see any grime or dirt anymore. And I'm just going to throw this on the floor. And now we're going to do our clipping to prep for the incision site and the surgery. First, we're going to start with the grain of the hair, because some dogs can obviously be longer haired, cats as well. So we're going to do that. And typically when you're done cleaning, you use a vacuum to just kind of pick up the excess hair, as well as one of the roller pins to get the lint off. And after you go with the grain, you go against it, which is how we'll do now. And we always want to be wary of our margins. So since this is an ovarian hysterectomy, we're going to go about 2 inches above the xiphoid process and about down to the pubis area. and just kind of keep our margins clean, cut, and nice. We don't want any weird shapes or anything like that. Okay. All right. So now after we do our clippings, this is when we'll kind of get our excess hair out of the way or use the vacuum if needed. And we're gonna start our scrub. This is where you might want to change of gloves also. We're gonna start with our betadine, and you're gonna start where your incision site is going to be. You're gonna kind of make a little line. And then what you wanna do is you always wanna go cleanest to dirtiest. You never wanna go back over that incision site. So we're gonna make a circle just around where the incision site would be, cleanest to dirtiest. And if you still have some of that hair in the way, you can flatten it, brush it down, slick it back a little bit. And initially when you first start, you want to grab your betadine with one hand and drop it onto the incision site, and then with your other hand do the scrub, and then you want to toss it, just put it on the floor. You repeat that with your alcohol, so you're going to grab it with one hand, drop it on the incision site, kind of make your line, and you're going to go around cleanest to dirtiest and drop it. And you're going to do this 3 sets of 3, so you're going to do this 2 more times before going into the surgery room to do your last scrub. So we have our patient ready to go. We transferred him from the prepping area to the place of surgery, and we have his endotracheal tube in. His anesthesia is hooked up. He is tied down, and we are going to do our last initial scrub before they cut. And we're pretty much going to do the same thing as we did with your typical prep, except we're sterile. And we're going to go ahead and get our betadine, and we're going to drop it on the incision site. You're going to move up and down from the incision site and encircle slowly away, cleanest to dirtiest, and just drop it on the floor. You're going to go in with your alcohol, drop it down, and it's really just preference whether how many times you want to do this or not. But with the last step, what you want to do is you want to leave a coat of betadine on top. That way it just protects the organs when it's being cut through. So we're going to do that now. Our last drop, around in a circle, just like that. And we're going to leave it, and the doctor will come in and do the surgery.